I'm very pleased to be here this evening to speak with a Democratic Party grassroots group. I want you to know I'm an elected delegate to the Democratic Party convention from the 41st Assembly District. So pleasure to be here with a sister organization. But I'm not here today as a delegate of the Democratic Party, and I do have to correct one thing in Mike's very generous introduction of me. I am not a current advisor to the president. I was an advisor to the president's campaign. But I do work on these issues a lot, and I want to share with you some perspective and information about not just Barack Obama's healthcare reform proposal, but the one that is emerging as a general consensus in the Congress among Democratic leaders in the Congress as well. Now, I was going to talk a lot about the problems that we face, but my colleagues here, Drs. Baldwin, Dario, and Hendrickson, and Robert Reich, and Dr. Schroeder's excellent video, have all done a magnificent job of doing that. So I don't need to reiterate what they said, but I do want to point out that the situation with the uninsured has gotten so bad that the greeting card industry has had to create a whole new line of cards that are designed just for the uninsured population, because the ones that everybody else has just don't cut it anymore. So we have a problem of 46 million Americans without insurance, 25 million Americans with insurance that doesn't cover expected high costs of medical care if they get very sick. We have a system that is out of control in terms of the growth in healthcare costs in all the ways that were already described, putting strains on families, on businesses, on government. It is the biggest single source of the growth in our deficit in the United States, the rising expenditures that we must make for Medicare. So we have to bring this system under control. But in addition, whoops, sorry. That's fine, thank you. We have very poor quality indicators also pointed out by my colleagues. So I'm not going to dwell on these. But what I do want to point out is that we had a campaign, a presidential campaign, in which all three key Democratic candidates basically had the same proposal. And Barack Obama was elected president, and his proposal is the one that he ran on and was very prominent in the campaign. These were not side issues. He got a huge mandate from the voters, and he also has, and the Democratic Party has, a significant majority in both houses of Congress. These are keys to success in getting healthcare reform enacted at last. We have been at this for 90 years in the United States, and it is time we were successful in getting a universal health insurance program or coverage enacted. But there are some obstacles to this. And one of those, I think, was pointed out by Dr. Hendrickson. I think he actually underestimated the amount of money that the pharmaceutical industry has been spending on lobbying on healthcare reform just this year in Washington. It is my understanding that they have been together, pharma and their member companies alone, and this is not counting the insurance industry, but pharma and its member companies have been spending an average of $3 million a day in lobbying the Congress, hiring just about every lobbying firm in Washington and their own armies of lobbyists, communicating their perspectives and their interests in the process. You can imagine that the insurance industry and other profitable industries in healthcare have been doing very similar kinds of good grassroots lobbying work with resources that overwhelm and completely dwarf the kind of effort that those of us who are advocates of progressive reforms, like those discussed earlier, can actually achieve and put in the field in Washington. But we do have strong leadership in the House on this issue. We have good leadership in the Senate, and we have very good leadership in the White House. We need to mobilize support for what they are doing, because they are our best hope of getting health care reform. What is it that they're proposing to do? Well, in the House, we have 3 House committees that have jurisdiction over health care reform. House Energy and Commerce Committee, House Ways and Means Committee, and the House Education, Labor, and Pensions Committee. That committee, those 3 committees joined together and developed a single health care reform proposal. That's a huge step forward compared to 16 years ago when President Clinton's own reforms were being countered by members of his own party in the House, and there was very little unity about the proposals being put forth. I'm going to speak mostly about that bill, but that bill has been voted on by 2 of those 3 committees. I think it's important to understand that the 3rd committee in that, chaired by our own Henry Waxman, has not been able to vote out that bill because of opposition from not Republicans. They would be the problem. They're a smaller minority in that committee. But opposition from Democrats. 7 blue dog Democrats who want to hold that process up to extract some important concessions. We'll talk about some of those. On the Senate side, we have the Senate Health Committee, chaired by Senator Kennedy, whose absence from actual involvement in the Senate is sorely felt in this process. Senator Dodd is trying to fill in for him in Senator Kennedy's absence. But that committee did succeed in getting its bill voted out by its committee, which is a great step forward, and it's a good bill. The Senate Finance Committee, chaired by Senator Max Baucus, is holding things up. Senator Baucus is trying very hard for the kind of bipartisanship that I think was Robert Reich was talking about in that video. That he is trying to get Republican votes, and what is it that he's going to have to give up in order to get any Republican votes, and how many will he get? Would it even be a meaningful number of Republicans, or would it simply be some window dressing? What is it that they are advocating? There are 8 points that I'd like you to keep in mind from these bills and from President Obama's position that define the issues and the policies that they're advocating with respect to coverage and affordability. I'm not going to get into the issues of quality and prevention. Those are very important, but that's for another meeting. Number 1 is the principle which Robert Reich articulated, which if you have health insurance that you like, you get to keep it. You don't need to make any change at all. But if you don't have health insurance, or if you have coverage that you don't like, you're going to have options. You're going to have options to choose a different kind of plan that will be affordable and comprehensive to meet your needs. That's number 1. So that's the overall global message that they all are trying to communicate with the policies and the principles in their reform bills. Secondly, all health plans will be prohibited from excluding anybody because of a pre-existing health condition, and they'll also be prohibited from charging more because of a health condition. They will be able to charge somewhat more based on age and geography, but not because of a person's health. All of the bills include that as a provision, and let's face it, the insurance industry accepted that from day one as one of the outcomes they were going to have to live with in healthcare reform. They said we're on board with that. Number 3, all adults and children will have to buy health insurance. President Obama opposed that kind of a mandate, at least for adults, but he has now accepted it. It is in all of the bills. That, by the way, was one of the conditions of the health insurance industry for getting on board with what is called guaranteed issue, the prohibition against excluding people because of their medical conditions. Number 4, individuals whose incomes are insufficient to be able to afford the costs of health insurance will get a subsidy. The House bill calls it an affordability credit, and these credits will go up, cover people up to 400% of the poverty level, 4 times the poverty level that Dr. Baldwin spoke about. People with low incomes will get a larger amount of help, as is logical. 5th, there will be an expansion of the Medicaid and the S-CHIP program. In California, we call it Medi-Cal and Healthy Families. People will be eligible for Medi-Cal and Medicaid nationally without respect to what are called categorical conditions. Right now, how many of you think that if you're poor, you qualify for Medi-Cal? You're partially right, but you're only partially right because in addition to being poor, you have to either be a child or in a family with dependent children, or be a disabled non-elderly adult, or be 65 and over. If you're between the ages of 19 and 64, it doesn't matter how poor you are. It doesn't matter how poor you are, you will not qualify for Medi-Cal unless you have one of those other conditions. So that will be eliminated. There will be a national threshold bringing all the states up to the same level of minimum eligibility for Medicaid. 6th, there would be shared responsibility with employers. Employers will have to either provide health care coverage to their workers and help pay for it, or pay into a public fund which would be used to subsidize coverage for their workers and potentially other people. Large employers will face that mandate. Very small, low-wage work firms will not. In fact, they will receive a tax credit if they do provide coverage to their workers. Major business organizations like the National Chamber of Commerce are opposed to this. Walmart, which has been, of course, for a long time, kind of a pariah among many of us, has turned around on this issue, as well as on environmental issues to a large extent, and they really have whole new corporate policies. They are advocates of the employer mandate and of health care reform, and some other businesses as well. 7th, there will be a health insurance exchange. That's what they call it. How many of you are familiar with CalPERS? Okay, so you know that public employees in California get to choose from a variety of plans, different kinds of plans and different options within a variety, from an array of plans that CalPERS goes out and contracts with and then offers to public employees in California. The Federal Employees Health Benefits Program does the same thing for federal employees and for members of Congress. All of these plans include very comprehensive benefit options, and they have information that makes them really comparable to each other. You can compare one plan with another. You know what you're getting when you sign up for a plan. You pay the premiums. That's what a health insurance exchange would do for everybody else in the country. And it's very much like that. Under this insurance exchange, you would have a choice of private plans or a public plan. And I'm going to talk about that next. But this is what it would essentially look like. You'd have a multiple batch of private health insurance plans and a public plan to choose from. So finally, we have the 8th point, a public health insurance option that Robert Reich talked about. And this public health insurance option would be like Medicare. It would be government run, and it would set a standard for health insurance coverage and the industry. that's why the health insurance industry doesn't want it. And it's why the Republicans in the Congress don't want it. And it's why the Chamber of Commerce doesn't want it, because it creates tremendous competition for private insurers. It would have a very large number of enrollees. It would be able to negotiate with doctors and hospitals and help to control the growth in healthcare spending. And it has the potential of being such a high-quality plan that is more affordable than private insurance, that it will attract a lot of business when people have real choice. The private health insurance industry is all for the free market, except that they want to be protected from the quote-unquote unfair competition of the government running a health plan, and they've always told us that the government can't run healthcare very well. And yet they're afraid that the government will run a health insurance plan so well that everybody's going to want to be in it. This is a key target in the healthcare reform debate. CBS poll just last week found that 2/3 of Americans want a government-run public health insurance option as a part of healthcare reform. And even 43% of Republicans say they want that. These numbers are down compared to a few months ago. And they're down because there's been a major campaign against this element of the proposal. And there has been an effort to drag out the process of healthcare reform so long that people get discouraged and begin to lose faith. So there will be some other issues that arise in this process that are important. How we're going to pay for healthcare reform, very important. And that in itself could hang up the healthcare reform process. In addition, how are we going to control the growth of healthcare costs? Who is going to be giving up some revenue in order to see costs better controlled? And of course, with all of these interest groups, basically feeding at the trough, where $1 out of $6 in our entire economy lie in that healthcare trough. When all of these interest groups are there feeding at that trough, they are going to have their hands on their money and they're not going to let go easily. Quality of care, very important. There are provisions in all three bills, the Senate Health Committee bill, and in the drafts of the Senate Finance Committee bill, which hasn't come out yet, and in the House bill. All of these bills have provisions that would attempt to improve significantly the quality of health care, as well as controlling costs, and an emphasis on improving health and prevention. California could be a big winner if we enact health care reform nationally. If the House bill were enacted by, according to Families USA, by 2013, 3.3 million Californians who would otherwise be uninsured will have coverage. And by 2019, 5.3 million would have coverage who otherwise wouldn't. So I think this is very important. Congress is going to be home at recess in August. Very important that all members of Congress hear from their constituents. Even Henry Waxman needs to know you're on his side. But all of the members of Congress, Republicans as well as Democrats, need to hear very loud and clear from their constituents that this is important, it can't be delayed, and that a public health insurance option, a real public health insurance option, needs to be a part of it. Thanks very much for all the work you do.